Alright, here we have the high flow nasal cannula. We use this in situations where patients have increased work of breathing and decreased saturation. This device can help meet a patient's minute ventilation demand and offload some of that work of breathing. This device is special because it is heated and humidified for the patient, and then we can separate flow from oxygenation. This device on Miller 4 can go up to 40 liters of flow. That is the max. But to initiate this device, anytime you see a patient working harder to breathe, this device should come into your mind. This can help support a patient's work of breathing. Flow can be anywhere from 10 to 40. If you have room to go up on your flow and your patient's working harder, let respiratory know and we can increase that flow. If you are at 40 liters and your patient continues to work really hard, please let us know. It's an indication to move to a higher support device. When we think about higher support device, we're thinking about a BiPAP. If you have a patient on 40 liters on this device, there is some literature that says if their mouth is closed while they're using this, there can be some positive pressure generated in the lungs. This is similar to PEEP or CPAP that causes the fluid in the lungs to exit into the pulmonary vasculature and allow the patient to breathe a little bit better. So this is a crucial device on your floor and may prevent a patient from moving to an ICU or needing the BiPAP at all. All right, max oxygenation on Miller 4 is 50%. So this device, even if we're on a higher flow of 40, we can drop the oxygenation down to a lower amount if they don't need it. But if we're finding ourselves maxed at 50% and your patient continues to desat, if it's rapid, throw a non-rebreather on them, call a rapid response. Or if it's a slow situation, let respiratory know and we can start moving things into place. So this circuit is completely heated and humidified, all this large blue tubing. This is where the humidifier ends, and then we have a non-heated circuit. So when this warm air hits this cool air, rainout happens and you'll have a lot of fluid collecting in this circuit. So being mindful of how your circuit is positioned, and then if you go to roll your patient, making sure that there's no fluid in the circuit. You can always drain it back into the humidifier, or you can simply disconnect. Your patient will be fine for the 5 seconds it takes you to disconnect and drain any water. If you have fluid in your circuit, or if you see a higher FiO2 than you had seen previously, you got report your patient's on 45% and you walk in the room and it says 65%, make sure there's no occlusion from your patient, maybe in the nares, or any water in the circuit that will give you an erroneously high FiO2.